Hi, thank you. Thanks a lot for the invitation and in this amazing location. So I'm going to present a work that is pretty much online with the two presentations that you've just heard. It's about educational gradient in unrealized fertility in Spain, and it's a joint work with my colleague Roberta Rutigliano. It's very much a work in progress, so any comment is especially welcome. So the context for this study, as I said, Spain. Spain is a country characterized by very low fertility levels since a while. Very high age at first childbearing, one of the highest among high-income countries, and high rates of childlessness. This goes together with the fertility intentions that, as for most high-income countries, have remained pretty stable and are on average on the standard two kids. We also know that the percentage of young individuals who declare that they don't want to have children is also quite stable over time and relatively low, suggesting that Spain is characterized by high level of unrealized fertility. Now, we just heard that there are many different ways in which to define and measure unrealized fertility, so here I a bit generally intend having less kids than what desired or intended. This high level of unrealized fertility can suggest that a society is not able to support individuals, so that the individuals encounters barriers. As we heard, it can be a signal of social inequalities if the ability to reach fertility ideals depend on socioeconomic conditions. At the individual level, it is important because it can be a source of low well-being, not being able to achieve fertility desires. So we do know that, educational gradients in fertility is obviously very much studied, an important topic, and we know that traditionally there is a negative gradient in fertility and a positive gradient in childlessness, meaning higher educated women tend to have on average a lower number of children and are more likely to be childless. This relationship has been changing over time. We know that it has reversed in some cases in some countries. In Spain, there is evidence that this gradient is still negative, but it has been changing. There are even signs of reversal when we look at couples at older reproductive age, where studies have shown that when both partners have higher education, they have higher fertility rates at older reproductive ages. We also know that material reasons are often suggested as important reasons in Spain for not achieving one's fertility desires. So it's important to know what this means in terms of fertility, unrealized fertility. However, the evidence on educational gradient in unrealized fertility is very little. It is obviously very difficult to identify people who have unrealized fertility or who are unintended childless. We know that different reasons can bring to childlessness, as we were just speaking about. These are often intertwined and difficult to disentangle. The little evidence that we know suggests that for most young European, childlessness is not intended. We also just saw this. And that overall, lower socioeconomic status is linked with, but that lower socioeconomic status is linked to intentions to remain childless. So in this study, we want to look at the educational gradient in unrealized fertility, which defined as having less children than desired. We use data from the 2018 Spanish fertility survey. So these, in line of the discussion we just had, is quite interesting because it includes very different measures on intentions. Here we look at the retrospective one, so with approach that is a bit similar to Esther, people at the end of the reproductive age that are asked whether the number of children they had is the one that they would have had. And we look at how this probability to answer that they would have wanted more children is shaped by education and whether the determinants of different fertility outcomes vary. And then we use the Basque demographic survey, This has been collected between 1986 and 2021. It also includes different measures of democratic behavior and fertility intentions. Those are prospective, so not retrospective. Obviously, it's focused only on the Basque Country, so a region of Spain that has some some specificities and some characteristics that are more in line with the rest of Spain that we can discuss later if you want or if you have any question. And there we can look over time at educational gradient in unrealized fertility. The potential mechanisms we identify goes in different directions. On the one hand, women with higher education are more likely to want lower number of children. On the other hand, they are more likely to postpone childbearing, thus to have less children than they desire, because they can encounter infertility linked to age. Women with higher education are also more likely to have the resources to realize intention, so even if they postpone, they might be more able to then catch up and have the number of kids that they desire. And then I don't enter here, I would love to, but women with higher education are more likely to be able to access medically assisted reproduction. I already spoke a little bit about the data, so Spanish Fertility Survey and the Basque Demographic Survey. When we use the Spanish Fertility Survey, we focus on women aged 40 and more, of which around 1,300 are childless. And when we use the Basque Demographic Survey, we use women of different age group depending on the analysis that we are doing. And we compare intentions and completed fertility at the cohort level. So we don't have longitudinal information, we do it at a cohort level. And what I'm presenting you is mainly some descriptive results. Well, I'm gonna skip these, but these can go a bit in the discussion in line with how to measure intentions. I will briefly speak about some potential problems with the measurement of intentions, especially in the Basque Demographic Survey. So here we have the proportion of, what did I do? Okay, sorry. We have the proportion of childless, childless and involuntary childless. So we see here relatively high proportion of childless women, aged 40 or over. Of course, at age 40, there could be still some women that go on and have kids. So we selected the ones that say they don't want more kids. So I think overall we should get a good estimate of women who don't have kids. So this is the blue. So they don't sum up together. So these are childless, so around 20% of women. And in yellow, we have the one that say they are childless, but they would have wanted to have children, so that we define as unwanted. And those are roughly half, or a little less than half, of the women who are childless. And what is interesting for for our research question is that you can see a clear gradient in childlessness by education. So an educational gradient in childlessness, but not an educational gradient or very, very little one in unwanted childlessness. The educational gradient can be seen also in women with unrealized fertility. So those are women who have kids, but have less kids than they would have wanted. This asked at the end of the reproductive age. We can see that the gradient increases with age, and there is a clear one. So highly educated women are more likely to have unrealized fertility. And here is just a simple logistic model where we look at the determinants. So this is controlling for age, partnership status, and income. And we can see, in line with what we just said, that having a tertiary education is a determinant of having less kids than desired and being childless, but not of being unwantedly childless, which is the yellow one. So when we turn to the Basque Demographic Survey, and here, I mean, a lot of discussion I think could be deserved just to the fact that, so we find pretty low fertility desires. We do think that this could be due to how the question is asked. So the question is asked in a bit of a strange way and not as it is recommended to do, let's say. So they ask, first of all, do you want to have children or more children from now on? And then for the ones who say yes, they ask how many, included the one you have. But we did see that many women, although they do have children, they say they would like 0 children. So I think there was clearly a misunderstanding in many cases about what the question was. We did assign, so we also did a bit of work with the data, so we ended up assigning to the women the number of children that they have, assuming that unwanted pregnancy are low. So it needs to be taken carefully. We do find low intentions overall, and especially we find very low intentions at young ages, which might be due to the way the question is asked, might be due to the fact that there is no temporal frame, so it's just asked, how many kids do you want to have, to very young people. So needs to be taken carefully, but it's a good opportunity to look at it over time. It's the first time that these data are being looked at, examined over time. They're not longitudinal, so they are cross-section, but over time. We can see a drop anyway in intentions from the cohort of 1952 to more or less the cohort of 67, 71, and then a slight increase or rather stable. When we look at the proportion, I think here the important is, so this is the proportion of desired number of children. And what we can see here by education, so tertiary and less than tertiary, and we can see here, as I said, pretty high proportion of people declare they don't want kids, a bit strangely high. And we can see, yes, thanks. We can see that there is a convergence by education, so an increase in people declare they don't want kids, and a decrease in people they say they want 3 kids or more among the lower educated, and the opposite trend among the highly educated. So I have to go quickly here. So this is at the cohort level. We see the proportion of women not wanting children. Again, very high level. Also consider that women with tertiary education in Spain, in birth cohort 52, were very few women. But again, we see a convergence in both measures. So both in proportion of intended childlessness and in childlessness. And we can see that there is a gap. So more people are at cohort level are without children than the ones they said, the proportion who said that they didn't want children when they were younger. And here again, at cohort level, we look at intentions among people aged 20-30, women, thank you, I'm done, 20-30, and then completed fertility at 40 plus. We can see a relatively small fertility gap, and surprisingly, for what we were expecting, small educational gradient in the difference. So there is a slightly higher proportion of women with the fertility gaps among the highly educated, but it is quite small and stable over time. Thank you very much.